Welcome to Climate Change and Health in Small Island Developing States, focused on the Caribbean. If you require translation into Spanish or French, please use the link posted in the chat or choose your desired language at the bottom of the Zoom screen. You should continue to keep this current browser open as well to utilize the chat and Q&A features. Please be sure to scroll down and mute the video. Please use the Q&A feature to submit any questions for the speakers. This session is being recorded. Thank you.
Hello and good afternoon, everyone. Thank you all so much for joining us in this very important panel on the impact of hurricanes in the Caribbean region. My name is Sadia Hassan. I'm an assistant professor at the Emory University School of Medicine and Roland School of Public Health, and a member of the Eastern Caribbean Health Outcomes Research Network. The objective of this panel today is to examine the increasing intensity of hurricanes in the Caribbean region and their adverse health effects. We focus on Hurricanes Irma and Maria as case studies, and the session will also address risk management planning for those most vulnerable to disasters, including people with chronic disease, and importantly, those with disabilities. I wanted to remind you that part of the goal of the conference is to use the information you hear about here to contribute to a draft research and implementation agenda that can be found in the tabs of the main conference website. So we urge you to please go to that site and add your comments to those documents. Now allow me to introduce our distinguished guests. So kicking us off will be Dr. Scott Weaver. Dr. Weaver is director of the National Windstorm Impact Reduction Program in the Engineering Laboratory at the National Institute of Standards and Technology based in the United States. Dr. Weaver also holds an appointment as an adjunct professor in the Department of Atmospheric and Oceanic Sciences at the University of Maryland. His research is focused on the intersection of extreme weather events and climate change. Thank you so much, Dr. Weaver, for your attendance today. Next, we will welcome Dr. Kalmudi Joshipura. Dr. Joshipura is an NIH endowed chair and director of the Center for Clinical Research and Health Promotion at the University of Puerto Rico Medical Sciences campus. She's also an adjunct professor of epidemiology at Harvard University. She has led several NIH-funded projects evaluating modifiable risk factors for cardiometabolic disease and has worked to also understand the impact of COVID-19. She is the principal investigator of the Preparedness to Reduce Exposures and Diseases Post-Hurricanes and Augment Resilience, the PREPARE study, which she will tell us more about today. Thank you so much, Dr. Joshipura, for your contributions today. Last, but certainly not least, is Dr. Barbara Carby. Dr. Carby is the retired director of the Disaster Risk Reduction Center at the University of the West Indies in Jamaica. She is a disaster risk management expert with experience in the public sector as well as academia as Director General of the Office of Disaster Preparedness and Emergency Management in Jamaica. She is also the founding director of hazard management in the Cayman Islands. Her research interest includes the integration of knowledge for disaster risk management and planning for persons with disabilities. Dr. Carby has received national honors from Jamaica and from France for her work in disaster risk reduction. Thank you, Dr. Carby, for being here today. I really want to encourage all of you to get engaged in this discussion. Please post your questions in the question and answering throughout the session, and I'll keep tabs of them. We're really looking forward to this panel discussion. So without further ado, Dr. Scott.
Okay, great. Let me just share my screen here. Thank you for the introduction and welcome everyone. Okay. Well, good afternoon, everyone. Today I would like to speak to you about the impact of multiple intersecting hazards during Hurricane Maria. Now, the brief talk I'm going to give for you today is not explicitly focused on healthcare per se, but instead the need for accurate and precise multi-hazard characterization of hurricanes to support impact-based studies. And those can include studies that are focused on healthcare delivery, mortality assessments, etc. So first, just a few statistics about Hurricane Maria. Hurricane Maria, when it hit Puerto Rico, it was a Category 4 hurricane. Previously, it was a Category 5 when it impacted some of the other Caribbean islands, but I'm focused mostly on Puerto Rico. And when it made landfall in Puerto Rico, it was a Category 4 hurricane. with 155 mile per hour, 1 minute sustained winds. That's only 2 miles per hour shy of a Category 5. The hurricane produced extreme rainfall and flooding across the entire island. There were thousands of landslides, some estimates in the tens of thousands. And Hurricane Maria caused over 3,000 total fatalities during its entire life cycle, with $91.6 billion estimated damage across its life cycle as well. And it turns out that this is the costliest hurricane in Puerto Rico history. Now, under two congressional authorities, the National Windstorm Impact Reduction Act and the National Construction Safety Team Act, NIST assesses all windstorm disasters. So if it's a significant windstorm disaster and their impacts, NIST will assess that, and on occasion may conduct a multi-year comprehensive impact-based post-windstorm investigation of an extreme weather event. Now, prior to Hurricane Maria, NIST had only conducted a full investigation of the Joplin, Missouri tornado, and that was very different because it focused explicitly on the wind hazard, and it was in a very localized area, so very different than Hurricane Maria. So a little bit about what we're looking into here at NIST. So due to the severity of Hurricane Maria and some other factors, NIST established the Hurricane Maria program, and that was to investigate various aspects of the disaster, not just the hazards. And so you could see listed here are several projects that span an array of different impact-based investigations, from the technical conditions that are associated with deaths and injuries, the performance of critical buildings, which could include hospitals and shelters, and also their dependency on lifelines, the public's reception to and response to emergency communications, infrastructure support, the recovery of critical social functions, and business and supply chain and its recovery. Now, compared to our previous experience investigating the Joplin tornado, Hurricane Maria presented a unique challenge, very different than what we were experienced with at the time, given that it affected such a large area and there were multiple intersecting hazards. So to do that, we needed to adequately characterize the hazard. And so one of the projects, potentially, the underpinning project for the investigation, is a comprehensive multi-hazard characterization to support the other projects. And so it's very critical to have as precise a representation as possible of the spatial and temporal evolution and intensity of these multiple intersecting hazards. And that's so that you could relate them to specific localized disaster impacts. So let's talk a little bit about that, just to familiarize maybe some folks who might not be, as acquainted with the physical geography of Puerto Rico. I wanted to show this map. It's a topographical map. It's a little crude. It's a little older, so it might not be the latest high resolution, but it basically carries the message that, what I want you to understand is that there's this fairly significant topographical feature that moves from west to east or east to west, depending on your orientation, across the island. And really what's notable is that you can go from sea level to a height of 1,000 meters or 3,300 feet very rapidly within a very short distance. And this actually has an impact on the types of hazards you will experience. And so let me show you an example of that. So here we are looking at the initial analysis of the wind field that was experienced during Hurricane Maria. Now, initially, our analysis was shown by the lines. So one way you can look at this is an example of what you would expect in Hurricane Maria based on the limited observations we have, if Puerto Rico was essentially devoid of topography, or at least minimal topography. So you could see the gradient where you have 120 miles per hour, 130 miles per hour, and then it drops off toward the southwest. But Puerto Rico has significant topography, as I had shown you. And so the shading denotes the shading in yellow and red specifically would be the area I would direct you to. Shows the topographic wind speed up effects. And so what this is basically showing is that while you may have expected there to be, or we think there was a wind that was, say, 120 miles per hour, it could have been upwards of 200 miles per hour based on the topography. And so that's a very different impact and has significant importance for life safety design of buildings, including critical healthcare infrastructure such as hospitals or other kinds of infrastructure. So that's the wind story. Often overlooked in the study of hurricane disasters is the impact of rainfall. So this graphic shows the percentage of fatalities as a function of the different hazards in US landfalling hurricanes from 1963 to 2012. And you can see that rainfall fatalities comprise 27% of the total. Now that's really interesting because it's 3 times the number of wind, right? So it's rainfall it causes many more fatalities than wind, yet we rate hurricanes by wind speed, not by rainfall. So, you know, as I mentioned before, like for wind, topography also enhances rainfall production. I'm not going to get into the reasons why in this talk, but there's a physical reason why that happens. And so having accurate measurement of the rainfall amounts in extreme events like Hurricane Maria, it's very critical because rainfall is used as a flood proxy in the absence of event-based flood mapping, which we don't have and we didn't have in the after effects of Hurricane Maria, and we still really don't have a good flood map. So rainfall is the first proxy. And then to get some modeling on flooding, rainfall is the primary input into hydrological models. And so that's really important for estimating floods, but also the occurrence of landslides. And then finally, climate change is leading to more intense rainfall rates. So being able to accurately measure the rainfall in extreme events is very important to understand those effects as well. But there are challenges with rainfall measurement in extreme events, significant challenges. And so here's an example of those challenges. And all I want you to show you here these are the differences between a radar estimated rainfall amount and a satellite rainfall amount. And really, this is an hourly map as Hurricane Maria was impacting Puerto Rico. And what's shown here are the differences between these 2 widely used measurement platforms. Now, if you look at the height of the storm in the middle panels, you could see that the differences were upwards of 150 millimeters, which I don't have a feeling for what that is. So I'll just tell you that's about 6 inches. The differences were 6 inches at certain places per hour. So that's a huge difference. And so one of the impacts of these is that given that we don't have really good event-based flood observations, it's a challenge to accurately model the island-wide flood inundation due to differences in rainfall amounts. And so this is actually a very important issue when you have such wide disparity in measuring a hazard. Regarding the climate change issue, so this is yet another reason, and potentially even a more important reason to have accurate rainfall measurement, is to relate the amounts that are experienced in a given storm to climate change attribution studies. And so this is an example of one study, and there are others that have used similar methods to look at other hurricanes. So in panel 1, it's an idealized climate model study of Hurricane Maria's rainfall. And so it's essentially been validated. It generally captures the representation of rainfall that was experienced across all of the different times on the island. It doesn't have the really great topographical influences, but we're just trying to assess what the climate change influence would be. So when the hurricane was simulated in the current climate, and then you can actually simulate it in the past climate and take the difference between those two to see how much rainfall associated with Hurricane Maria is related to climate change that has already occurred. And so that's what this panel is showing. So essentially, according to this study, Hurricane Maria's rainfall was already made more intense by climate change that has already occurred. Maybe not, vastly more, but significantly for sure. And then you can also simulate it in a future projected climate with the global warming of 80 or 100 years from now. And this panel shows the difference between the future climate scenario and the current climate. So this is the change from today and into the future. And basically, this indicates that if a storm like Hurricane Maria were to occur in the latter portion of the 21st century, the rainfall would be unprecedented. It would be something that had never been experienced before. And so if you take that idea and associate it with the previous amounts of rainfall that I've already shown, you get a picture that is quite damaging and would have impacts that are just completely unprecedented in our history. And so that's all I have for now. If there are any other questions, I'll be happy to answer them or send me an email. Thank you.
Dr. Weaver, thank you so much. That was really a striking reminder to all of us of the impacts of hurricane, that beyond wind, we need to think of rainfall, but also starting to highlight for us some of the gaps, which hopefully we'll have some more time to talk about later. And so with that, I'll turn it to Dr. Joshipura.
Good afternoon. Thank you very much for the introduction. So I'm going to cover the impact of Hurricanes Irma and Maria, and also preparedness, resilience, and health in Puerto Rico. I can't seem to move my slides somehow. Okay, so I guess Scott already covered some of the damages from Maria, and Irma was 2 weeks earlier with much less impact. And the big thing in addition to the floods was that a lot of people lost, almost everyone lost power, and a lot of people lost water and also connectivity. I personally experienced this, and I must say it was the experience of my lifetime, and still I have no regrets. Before the hurricanes, I felt like I didn't have enough guidelines to prepare, and whatever information was available was too little, too late. The stores were already depleted after the warnings, and there was some wind and flood, a lot of wind and flood damage in my apartment. So I personally experienced this, and the aftermath was beyond any imagination. There were challenges of power, water, concerns about food and fuel as well. Despite all this, there was an excellent community of spirit, and you could feel the resilience in the people. I personally learned a lot. I learned I should prepare better, but also to keep fit, because I lived on the 12th floor and I had to climb up and down to my apartment carrying stuff. And as a public health professional, I wanted to see what I could do to help the population. So I looked at the literature, and the US studies did not focus on the Caribbean or the US territories. And there was a gap in terms of specific to the Caribbean, but also in terms of preparedness. The level of preparedness before hurricanes is low, despite people being in hurricane zones and knowing what is coming. So some surveys showed that only 30 to 40% had emergency supplies, and only 45% were prepared, and only 22% were well prepared, although a very large proportion felt they were well prepared. And if you take objective measures of having food and water and medications to last even more than 3 days, very few people actually had that. So this lack of preparedness may be due to the unclear messages and lack of time and resources. So we need better messages. And there was also a gap in evaluating the role of preparedness in health. So does that impact health, what we do? As people may be aware, right after hurricanes, the deaths due to the wind and floods, the direct impact was around 64. However, a year later, the estimates were around 3,000 and even ranging almost to 5,000. Why is this big difference? This may be likely due to the non-communicable disease that were increased after the hurricanes, and that's what I'm going to cover here. This led us to the Prepare project to understand the gaps in preparedness, information, and resources, and to understand associations between preparedness and health, and also to evaluate resilience in this context. We also had another aim about organizations, which I won't be getting into here, and to translate and disseminate information to improve preparedness and resilience. The Prepare study built on 2 ongoing cohorts. One of them was called SOULS, and that was based primarily in the San Juan area, but we also had enough people from outside, so we oversampled the people from outside to get a more representative sample. These were overweight, obese, high-risk Hispanic people, 40 to 65 years of age, free of diabetes and major chronic conditions. From the 1,000 or so who completed the SOULS follow-up, we had 364 who completed the Prepare assessments, which included interviews, blood pressure, weight, and glucose measures. We already had this in the SOULS, and we added measures in the Prepare after the hurricanes. And then we had a parallel study from the Federally Qualified Health Centers, COSMA, which captured the rural eastern central region of Puerto Rico. And those interviews were conducted from 2019 to 2021. And we chose people who already had data in the medical records for the pertinent information about diabetes. COSMA participants were people with diabetes and SOLs were without. And from COSMA, we targeted and recruited 125 people. We conducted descriptive statistics, logistic regression analyses, adjusting for age, cohort, location, education, and date of interview. Since the interview spanned the earthquakes and the pandemic after that, we also added questions on that to control for that. We looked at the main outcome, which was what people reported. Did they have a health impact from the hurricanes? That was our primary outcome. And we also assessed non-communicable disease individually and as a group. Our exposures were preparedness, water disruption, and diet changes due to the hurricanes. So we had the age distribution of roughly 60 years of age on average. Majority were females, and this was a low income population. The COSMA group was even lower income and lower education than SOLs. The main gaps in preparedness were that only 41% reported high pre-hurricane preparedness. Only a quarter reported gaps in information, such as emergency management and general information. And almost half reported that they had gaps in resources because, as I said, it was a low-income population. And they talked about financial gaps and alternate energy, home protection, as well as water storage. We looked at associations of various factors with the health impact that people reported. And our primary exposure was preparedness. So people who had low to medium preparedness were twice as likely to have a detrimental health impact compared to people who were highly prepared. And this was all statistically significant. Similarly, we see short-term diet changes due to power loss. They could not cook or refrigerate their food. And that was also almost a twofold difference. If we looked at long-term diet changes, we saw almost a threefold difference, and this may be due to finances or access to shops. A lot of the things were disrupted after the hurricane for really long, and people lost water up to 3 months, and the longer duration of water loss was also almost a threefold difference. So people who lost water for longer were more likely to have a detrimental health impact. We also assessed the diet, and people were consuming more fast food, salt, and sugary drinks after the hurricanes than before because of the lack of availability. We have another paper tomorrow that will discuss the diabetes incidence that was increased after the hurricanes. This is what interests me the most, to see the post-traumatic growth, which I myself felt after the hurricanes. And we use that as a surrogate for resilience. And the PTGI score was higher among people who had a health impact due to the hurricanes compared to those who did not. However, when we looked at for specific non-communicable disease and see if people got them more after the hurricanes than before, we did not see any difference. This shows the direct impact of the hurricanes, which could be injury, impact on health, family's health, finances, and/or damage to homes or appliances compared to people who had no direct hurricane impact. We conducted linear regression analyses controlling for the same factors. And if you look at the figure, you see the orange bar is people who have had 5 direct impacts. So they have had all the issues, the negative issues of the hurricanes, and yet they have grown, they have resilience, and they have felt a positive growth. So this is very heartening. One of my goals is to take all these findings as well as preparedness messages to the translation and to disseminate it to a wider audience, especially people who have never experienced this before and they are getting hit. So we have developed brochures. This is all available on our website, brochures for individual, general information, tips for managing food, tips for managing what to do for water and what to put in your emergency backpack, things like that. We also have brochures for organizations as well as for communities. This would not have been possible without a very large team of people. as well as the NIH grants and the participants who played a big role. In terms of the increasing context of climate change, the number and intensity of hurricanes is increasing tremendously. People who have never experienced hurricanes, even that are not close to the coast, are getting hit pretty hard. And the pandemic has added new challenges, especially for things like evacuation. Should you evacuate and risk COVID, or should you not evacuate? And lots of other challenges for the healthcare organizations. We really need interdisciplinary efforts integrating individuals, communities, and organizations. And importantly, not only to prepare and address the hurricanes, but we need to all do our bit to reduce climate change and its impact. If I could pick one key message, when people show preparing for a hurricane, they show pictures like this to grab lots of bottled water. And this is really not the way to prepare, because this is where it all ends up. So if we combine our consciousness for reducing climate change and preparing for the hurricanes, we need to think of sustainable ways like getting filters, getting means to store rainwater, to purify the water you have, and to really do this in a more sustainable way. So the future really depends on what we do today, tomorrow, and the next day, but we cannot wait any longer. We need to act right now. Thank you.
Dr. Joshipura, thank you so much for that wonderful presentation, a reminder of the health impact with a focus on chronic disease. And when the Caribbean region is already burdened with NCDs, it's a real reminder that we need to design better programs to help people living with chronic disease, but also a reminder that it is a call to action for all of us.
Yep.
So thank you so much.
Thank you.
And I'll turn it to Dr. Carby now.
Good afternoon. First, let me thank the organizers for inviting me to be a part of this panel. I'll look briefly at the whole matter of hurricane planning for persons with disabilities, removing the barriers. Quick outline of the presentation. And I should note that although the title says hurricanes, really the talk applies to disaster risk management planning as a whole. So we have a little background information on Jamaica. Then we look at some of the barriers to persons with disabilities, current efforts at removing some of those barriers, what more can be done, and some research gaps which should be addressed. Jamaica is located in the North Atlantic hurricane belt and within the Northern Caribbean plate boundary zone, which leaves us exposed to a multiplicity of hazards: seismic, climate, weather, biologic, anthropogenic, and so on. Our population is presently estimated at 2.9 million, measured in 2011 by the census at 2.7 million persons. The population reporting disabilities, over 600,000 Jamaicans reported disabilities related to sight, hearing, walking, and communicating. That's about 22.5% of the population. Further, another 200,000 plus reported disabilities related to lifting, self-care, and remembering and concentrating. What are some of the barriers faced by persons with disabilities, which might be significant in emergencies, although they're also faced in normal times? Emergency shelters do not, generally speaking, have elevators. Many do not even have ramps. There are no grab bars in sanitary facilities. And shelters don't normally have enough space for equipment which may need to accompany persons with disabilities. For communications, precautionary information is usually available in print, and this information, I must say, is really of very good quality, but not available in Braille. And there's only intermittent use of signing for emergency and warning messaging. There are also attitudinal barriers. We tend to cast persons with disabilities only as victims, with no recognition of their potential to contribute to disaster risk management planning or operations. There are efforts ongoing at removing barriers. There is a legal and policy framework. Jamaica's policy on PWDs dates back to 1999, and the legislation was put in place in 2014, guaranteeing the rights of persons with disabilities to full inclusion in society. But how does this then translate into disaster risk management practice and planning? This information comes from a survey among Jamaican government ministries and local authorities. There are current efforts to retrofit emergency shelters with ramps, with more disability-friendly sanitary facilities. But really, we have not gone very far along this route. Fewer than 10 have been fully retrofitted. There are provisions for persons with disabilities included in some disaster risk management plans at national level. A third of ministries reported that their plans included provisions for persons with disabilities. At the local level, the figures were better. 64% of local authorities reported having these provisions. And these included providing preparedness information and emergency information through wardens or local disaster teams, also providing assistance with preparations for hurricanes. So persons with disabilities can get assistance with, say, battening down their windows, stocking emergency supplies, and with transportation for evacuation. In the post-disaster phase, the plans include ensuring that persons with disabilities do have access to emergency supplies, as well as to access for recovery assistance. The question is, though, are we planning for persons with disabilities, or are we planning with them? Jamaica has a very long history of participatory planning for disaster risk management, dating back to the 1970s, 1980s. But persons with disabilities are largely now excluded from participating in disaster risk management planning. No ministries and only 1/3 of local authorities include PWDs on their disaster risk management planning committees. And persons with disabilities are not given any roles during emergencies and disasters. So we see again that PWDs are seen as only being in need of help, not as a potential resource. However, the experience from the Indian Ocean tsunami showed that PWD organizations had the capacity to help with response, but they lacked resources. What should be done? Well, evidently we should continue the retrofit program for emergency shelters. I would say that it should be expanded to ensure there is adequate provision for medical and other equipment, and also for caregivers being able to accompany persons to emergency shelters. Attitudinal barriers. We need to change the perception of PWDs only as victims. Recognize the knowledge, skills, and experience they bring, which can contribute to planning, and include them in planning committees for disaster risk management. Again, removing barriers, a very important area now of precautionary and warning information. The graphic to the right of this screen shows the kind of graphic that weather personnel use to inform the public of potential threats from tropical systems. Now imagine seeing this on your television screen. Actually, you're not going to be able to see very well the key at the bottom of the screen. If you're hearing impaired, what you will see is the presenter standing there explaining the different symbols, but you won't be able to hear, evidently. So ideally, the graphic should be accompanied by somebody giving an interpretation through sign language, or having a text accompanying the visual display. So in the same way that we have subtitles for movies, we would have subtitles or a scroll for the graphics for warning and precautionary information. For those persons who are color vision deficient, hatching as well as color coding should be used. For persons with cognitive impairments, then simplified language and pictures showing actions should really be used. And of course, for persons with sight impairments, we should have our information in Braille. Research gaps. We need more research into environmental communication and attitudinal barriers in the public sector, with the results to inform a program to remove barriers. Research into PWD's views, needs, and skills related to DRM so that they can better be incorporated into DRM planning. Also, societal attitudes to persons with disabilities. Do we, in fact, treat our persons with disabilities as second-class citizens? And these results will be used to inform public awareness programs on the rights of PWDs, as well as to inform DRM planning. Further, how and to what extent do barriers affect PWDs in normal times as well as emergencies and disasters? Because you could have effects on their rights as citizens, their mental health, as well as their physical well-being. And finally, I would say that in Jamaica and the Caribbean, persons with disabilities are an underserved community, and the area of persons with disabilities in disaster risk management is under-researched. There is, in fact, the opportunity for the research-practice partnership to flourish, and we should grasp it. Thank you.
Wonderful. Thank you so much, Dr. Carby, for highlighting the needs of people living with disabilities, and importantly, the importance of us, truly engaging the community of people living with disabilities in that planning and preparation. And so I'd love to now invite all the panelists to put their videos on, and we'll start a panel discussion where we'll highlight first some of the questions from our audience. So I'll start with Dr. Weaver. So you had a couple of questions, and one is really alluding to that last graphic that you showed, comparing the rainfall from Maria to pre-industrial and then future predictions. There are two questions related to that. So one is, can some of those differences be explained by structural differences in the pre-industrial versus current era? The person is alluding to the fact that there were some areas with kind of a brown connoting negative values. And to that, if you can talk a little bit about whether or not there is a way to predict rainfall for future purposes, which was a second question.
Sure. So in a sense, there are structural differences. So think of a hurricane like having two lungs. It breathes in, breathes out, right? So near the center where you have the most intense rainfall rates, not directly in the center, because we know that those are usually clear. That's where the eye is, and it's actually very calm weather. But right in that eye wall, where you have the most intense rainfall rates, you have, in addition to the horizontal wind, you also have extremely strong vertical motion that helps sustain the rainfall. That's what produces rainfall. And so what happens is if you're looking sideways through the hurricane, you have this vertical motion that then will, at the top of the atmosphere, will fan out and cause sinking motion outside of the hurricane circulation. And so that would actually, that could be the explanation for why you see decreased rainfall rates around the outer parts of the hurricane. It's inhibiting that part. So it's really a reflection of the strengthened circulation from within to the outside of the hurricane. The other question about, I didn't see, oh, here it is. Is there a way to predict the amount of rainfall? Yeah, I mean, we right now, I'm assuming you mean in a given event, not necessarily in climate change. What I showed was essentially, you could argue, is a projection of what Hurricane Maria would be in the future if we allow a significant amount of climate change to happen. So it's predicting that there would be, if the same exact storm were to happen again in that scenario, you would get much more rainfall than you already had currently. But if you're asking about, like, can we predict the rainfall in a given event? Yeah, we could predict it fairly well, not perfectly, of course. And as I mentioned, that in a place like Puerto Rico with those topographic effects, that will complicate a hurricane model's ability to get more accurate representation of rainfall. But over a flatter area, the model would likely be more skillful in being able to capture the intensity of a given hurricane's rainfall. So I hope that answers your question.
Thank you so much. I think that was terrific. I did want to, before I move to some of the hurricane preparedness questions, would love you to answer, Dr. Weaver, of how your organization now is working with the government and working with those who are involved in the health sector and the disaster preparedness and planning. How is all of this important information that you're gathering informing that policy and action?
So as I mentioned in the talk, we have several authorities that we operate under. So initially, I'm going to try to do this quickly, but the National Construction Safety Team Act, that was born out of the World Trade Center disaster and was focused on building failures in any kind of disaster. And so had we only had that authority, our ability to conduct a more broad-based investigation of something like Hurricane Maria would be a bit hampered, although we'd still be able to find out very important information, emergency communications, failures of critical infrastructure like hospitals. We'd be able to still investigate that. But if you recall the recovery projects, the projects that are focused on societal recovery and some of the other hazard projects, that would not be happening without the National Windstorm Impact Reduction Program. So there are these two federal authorities that we operate under. And particularly as it relates to health, we are looking at the critical infrastructure, the critical health infrastructure in Puerto Rico, but also one of the projects, as I've shown you, and actually the speaker you were supposed to have today was going to detail the mortality project, but that's not my area of expertise, so I wanted to focus on something like that. There is a comprehensive project looking at the technical conditions associated with fatalities. It's not another fatality count, but really getting in and trying to understand, and not just from the event itself. Remember, these events, they happen over the course of a day, but there are things both in the geophysical natural environment as well as in the way society is prepared that underpin susceptibility to these disasters. And as I mentioned, that's not just in the societal realm. If a hurricane occurs during a drought, you're going to get much different impacts than if it occurred in a time when you've had a lot of rainfall prior to the event. That's just one example. There are many like that. And so, we're looking at all of those things.
That's great. And hopefully more of this information can actually go out to the public in digestible format, so that more of the public, the lay public can be also informed of this.
Absolutely.
So moving a little bit to hurricane preparedness, and there's a few questions here for you, Dr. Joshipura, really looking to understand from you, maybe that part that we didn't talk about, which is that organizational level preparedness. And so one of the questions is asking, should authorities be really examining preparedness plans that support services really focused on economically disadvantaged communities and those with inherent risk factors, such as those with non-communicable diseases? And a similar question, so maybe if you could answer both of them, is whether or not there's an emergency preparedness plan at the government or level that's focused on chronic disease.
Yeah, so absolutely, yes. I mean, organizations should be focused on preparedness for the regions. And, as people may be familiar, the response to the Hurricane Maria was really lacking from the federal government. I think people remember the scenes of the paper towels instead of getting anything more useful. So right from the federal government, etc., there were issues, and there does need to be more comprehensive plans, not only from the government, but also there are many nonprofit organizations. And I think we really need more integrated efforts as to getting the messages from the individuals, what are the issues the individuals have, what are the issues of the healthcare organizations, and how can, people like Scott and people like, from other organizations that are like FEMA, and what can everybody do better? And specifically to the economic disadvantaged people, I mean, it's one thing to tell them you should prepare this and stock up on this and that. A lot of people reported that they didn't have, they didn't have alternative power resources, and that all these things impact the health in a long-term way. The hospitals didn't have resources. So yes, I think we do need more resources in these Caribbean islands and places, not only regions that are economically disadvantaged, but people that are economically disadvantaged, to give them the resources instead of the messages of what to prepare, because it's meaningless if they don't have the means to get those things. And even I think Barbara touched on the evacuations, etc. So it's one thing to tell somebody to evacuate, but if you're really old or disabled, or you don't have the means, you're bedridden, I mean, how are you going to evacuate? And we need to kind of plan in advance to have a list of people, and it goes individual preparedness, community preparedness, and organizations. They all need to kind of go hand in hand together, because we need all three. And specifically to chronic disease, I don't think there's anything at a more global level or at a government or federal or territory level. So there may be smaller organizations that are addressing needs. There may be diabetes organizations addressing needs of people with diabetes. The healthcare organizations do what they can, but there isn't really a global plan. And to remember that it's not only people that have the chronic disease, but even people who don't have any chronic disease, they're at increased risk of getting the disease if they don't have the means to get clean water and food and all the other effects that go with this.
Thank you so much, Dr. Joshipura. And really a testament to what we're trying to accomplish in this conference is bringing those interdisciplinary and multidisciplinary folks together to really start to create that model of integration that you're speaking about, that we so direly need, I think, more of in the region. I want to turn to Dr. Carby. Thank you, Dr. Carby, for joining us. I know there's internet connectivity issues where you are, but I'd love for you to piggyback off of some of those comments that Dr. Joshipura had. And what advice do you have for those in the disaster preparedness realm of what the best approach is to try to incorporate more of the needs of people living with disabilities into disaster preparedness now? And you spoke a little bit about the importance of engaging people living with disabilities. So I'd love some more thoughts from you on the concrete actions we can take today.
All right, thank you and good afternoon. Well, I would say I would place very high importance on removing environmental barriers. The shelters really have to be better equipped, and I would see that as a priority. The issue of information also, because an informed community is a more prepared community. The PWD community is actually willing to assist itself. So if it has information, then it can do that more effectively. And of course, the attitudinal barriers, that will require a massive push, I think, from the level of the national government to try to change the attitudes within society. So I think what would be important here as a supporting mechanism is the data that researchers can bring to the table, so that the planning, the public awareness can be evidence-based.
Great, and I think that call for evidence is really important, so thank you. And I'll piggyback off of that and ask both Dr. Weaver and Dr. Joshipura what you think are the important research and implementation gaps in your two areas that we need to be addressing as really an output from this conference. Dr. Weaver?
Sure. Well, I mean, you know, we haven't talked about how we, specifically in terms of the physical hazards, how we deal with that. You know, we spend so much time, you know, in buildings and in structures. I mean, that's, you know, we live in our homes, you're in buildings most of the time. And so one of the things we're focused on, if you recall, from one of the slides I showed, you know, we think the wind hazard was this, but because of the topography, it's actually quite different. And so when you go to set the design standards for building different classes of structures, we need to know, you know, most of that is based on the historical record. And so that's fine if things aren't changing. But what we're finding is that we need to figure out a way to connect the historical record to climate model projections to be able to develop design standards for infrastructure, for buildings that are future oriented. And so, you know, I'll give you one example that actually relates to the rainfall. The main rainfall product that's used for infrastructure and civil engineering design is called NOAA's Atlas 14. It hasn't been updated in some parts of the US and in Puerto Rico in some cases over 2 decades. And so essentially, if you're using a rainfall record from 1950 to 2000, which is completely out of date, even for current standards. So you're already, even if you're already behind. And so we need to figure out a way to develop those tools with a forward-looking thinking. And I think you know, a lot of the inertia around that is, well, you know, some of these climate model projections are not as certain as we would like.
Yeah. And
there's some truth to that. But from what I just showed, some of the observations we have aren't so great either. And so in some cases, in the extreme events. And so we need to kind of connect the historical record with the future projections a little bit better and start thinking about if we're designing for 2050 or 2070 or 2090, what are we going to be facing then, and get those kinds of design standards into the building stock now, because that takes time for the density, you know, the building penetration to build up. And I know we're focused on Puerto Rico, but that's worldwide and certainly for the rest of the United States as well.
Thank you so much. And I'll give Dr. Joshipura the last word here. And if I might ask you, Dr. Joshipura, in your response to those key research and implementation gaps, if you could speak a little bit on the impact of COVID on everything and our preparedness, which was one of the other questions, and really how perhaps, you know, this what you saw in terms of increasing chronic disease rates, how that might change over time, given the high resilience that you saw in your population, which was another question. So please go ahead.
Yeah, so let me talk about COVID first. And I have also been working in a COVID project in parallel. And I think the message that is generally given is that we should prioritize the disaster because it is very immediate. And it's, you know, if you don't, if you need to evacuate and you don't because you're afraid to go with people who may infect you, you're still safer evacuating than not. And that's a very important message for people to keep in mind. The other important thing to understand is that the total deaths from the Hurricane Maria were 3,000 plus. The total deaths in Puerto Rico from COVID to date is around 3,000. So if you look at over 1 year, the fear of COVID is much more. You can't imagine, most people would think that the COVID deaths must be much more, but just one hurricane had a very huge impact. So I think what, you know, there are things that don't contradict. So you need to do your best to prevent yourself from COVID and to prevent yourself from the hurricane. And we've also developed materials to combine the two that, you know, you talk about masks, but you need the face shield when you're going out in the rain and the storm after the hurricanes. And if you have to evacuate, it should be part of your emergency backpack. So the other part you mentioned was the resilience. And I think what we saw, like I mentioned, that the diabetes incidence increased and the non-communicable disease in general increased and the overall health impact increased. We also looked specifically at asthma and depression, and they did not increase. after the hurricanes compared to before. So that's unpublished data, but the resilience is evident. You could kind of feel it, personally as well as through the data. I think the resilience data is also very interesting, that the more people were impacted, the more resilience they had. So the resilience is obviously mitigating. And I think there was also, what the governments didn't do at the bigger organizations or the government level, people did themselves in communities, and that may have had a very positive impact as well. So in terms of the research gap, it's really, the integration of all these disciplines. We've kind of done it separately. The organization piece was entirely different from the individual assessments. And if we could kind of tie it together and assess those same organizations that the people, went to or got some responses for, we had some questions, but it wasn't enough. So more integrated study. And also, ideally we need longitudinal studies. And how do you do longitudinal studies? Because nobody predicted Maria, right? So I think that's the real challenge. Maybe, in very disaster prone areas before the hurricane season, we could do studies, some people, and assess all the preparedness, everything they do for the hurricane season. But it's hard, you don't want to predict that the hurricane is going to hit that area, and maybe it doesn't that year. So that's really a gap. So we piggybacked onto these existing resources. And that's why, there are specific strengths and limitations related to that. So there are many research gaps. I think overall specific aspects of preparedness, of water, of diet, what exactly helped and what exactly harmed them. I think, much bigger study, more representative, and with more longitudinal data. And translation, I think the gaps are huge. I think that's where my passion is. We already know a lot. I mean, you can quantify, for each disease, but is that going to help us? What really helps us is taking the messages we already know. And I feel like everybody in the world should be prepared, if not for hurricanes, but for some disasters.
Yeah.
So I think getting that message to people, exactly how and what to prepare, I think that's really key.
Thank you, Dr. Joshipura. And I think that's a wonderful note to end on, is that call to action and a call for preparedness and a call for integration. So thank you all so very much to the panelists, Dr. Weaver, Dr. Carby, Dr. Joshipura. We cannot thank you enough. This was truly very, very impactful and interesting. And to the audience, moving on to the next session, thank you for joining us, and I hope you enjoy the rest of the week.
Thank you.
Thank you.